Hi, everybody. We're gonna make sure that people have a chance to get in. Sometimes it takes a second for that Zoom link to go ahead and kick in. So if you've joined us, you're not missing anything in the audio. We just want to make sure that everybody has a chance to join in and hear the full message before we get going. We'll wait about 30 more seconds. All right, let's go ahead and get started. So welcome to the NEBA Virtual Career Expo, and I hope that you are very interested in what we have to offer here with our last session of this time period, this is awesome. This is careers in healthcare. And before we get started, though, we have a special message from the governor of Missouri. If you're a Clay or Platte County student, then it's our newly reelected governor has created a special message specifically for this event. We want to show that. It's about 1.5 minutes long or so. And once that finishes, then we'll come back, we'll do some introductions, and we'll get going. So with that in mind, let me click on share screen and get the video rolling.
Hi, I'm Missouri Governor Mike Parson. I want to welcome you to the Northland Education and Business Alliance Virtual Career Fair. A little over 2 years ago, I made infrastructure and workforce development the top priorities of my administration. Now more than ever, we see the need for Missourians to gain the skills, technical knowledge, and real-world experience they need to prepare for high-skill, high-demand jobs. To our students, thank you for taking an hour out of your day to look at opportunities we have right here in Missouri. We are proud to have many high-quality schools and training programs in our state, and we want you to find a career opportunity that's right for you here in Missouri. With creative events like the Northland Education and Business Alliance Virtual Career Fair, we hope to provide possibilities for all of our young adults, and we appreciate our industry professionals and guest speakers for their sharing opportunities with students in Clay and Platte counties. Hopefully, you find a career path you will want to follow and find a passion to make a difference in not only your life, but to make Missouri a better place to live, work, and play. Some of you may create businesses that employ hundreds of people. Maybe one of you will be delivering this message to future generations as governor one day. Knowing that anything is possible if you have the will to try and the faith to believe you can. You are the future of the state, and I believe in you. It is an honor and privilege to be the 57th governor of the state of Missouri. May God bless you, may God bless the great state of Missouri, and may God bless the United States of America.
All right, so let's get going here. Again, welcome to the Virtual Career Expo hosted by the Northland Education and Business Alliance. My name is Brett Kisker, and I'm actually the Executive Director of the Northland CAPS organization, which serves 16 high schools up here in Clay and Platte counties. I'm also a member of NEBA. And NEBA is a network of education and business organizations in Clay and Platte County, and our vision here is to promote and provide business-driven educational opportunities for you, because you, if in our audience, you're the next generation of business leaders. We hope that here in a few years, you're the guest speakers in this event. We don't want you to leave. We want you to stay and be game changers here in our local community. I'm going to be your host during this session, but I actually have 2 other people working behind the scenes to help make this thing actually successful. So one is Adam Jelinek, and you can see him. He's waving now. Adam is the co-chair on the business side for NEBA. He's also the HR programs coordinator at LMV Magna up in Liberty. It's a manufacturing facility. We also have Julie Lewis from the Clay County EDC, the Economic Development Council. And so she works hard with a lot of local businesses to help make them successful in the area. And both of them are doing very important things in the background to help make sure that today's 40-minute session is successful. A few quick notes before we begin and do introductions of our industry experts, the more important people in the room here. This session will last for 40 minutes with a hard stop at 1:40 today. So our experts here, Kristen and Stacy, are going to begin by sharing the professional history and insight But what we want this to feel more like is a conversation. So at the bottom of your screen, if you look at the bottom, there's a Q&A button. And we want you to start posting questions there about anything you want to know about careers in healthcare. And that's our goal, is to try to answer those. We might not be able to get to them all, but we're going to do our best. And when the session ends, you'll be asked to take a very short survey so we can get better at this kind of thing in the future. And last but not least, this session will be recorded. We got to find a way to make it available to you online in the future. So with that in mind, I'd like to go ahead and introduce our two very special guests today, taking time away from their valuable days. Time is money. This is a big deal to get people that work in the healthcare field right now to come talk to you guys about their careers and their days. But we have Kristen and Stacy. And Kristen, why don't you go ahead and introduce yourself and tell us a little bit about what you do and how you got there?
Sure, I'd be happy to. Thanks, Brett. Hi, guys. I'm Kristen DeHart. I am the CEO at Excelsior Springs Hospital. I think everybody hopefully knows where Excelsior Springs is, a little town up north of Liberty, just about 12 or 14 miles away. And I have been honored to be the CEO of our hospital here for a little over 3 years. My career path started really thinking about healthcare when I was in high school. I had an injury that created a lot of doctor's appointments with a pediatrician. And I thought right there, I wanted to be a pediatrician. My mom happened to be my guidance counselor at Garden City Community College. And she said, I appreciate that you want to be a doctor, Kristen, but there's no way you're going to tolerate school for 12 to 14 years. And I said, yeah, let's find something else. So my mom actually introduced me into the field of athletic training, which then took me into the field of physical therapy. And I graduated from Garden City Community College with a minor in athletic training, went on to K-State for 1 year, and then graduated with my degree in physical therapy from University of Kansas. I do live in Missouri. My family lives in Liberty. I still don't know a whole lot about that Columbia MU thing over there, but we do see a lot of a good camaraderie and good sporting events, fun things like that. So my love and my passion has always been in the field of along the lines of physical therapy and athletic training. I'm trained to look at those injuries and that sort of thing, but immediately went into a field of management, actually. Started working in long-term care, worked at many of our acute hospitals across the Kansas City metro area. Took a position with a larger term company and became a national director, which took me down a marketing pathway, marketing and sales. And then really kind of wanted to come home. I got a little bit tired of being on the road 5 and 6 days a week and had a wonderful opportunity to come back and be a CEO for a small rehab hospital in Overland Park. And then my career brought me back home up to the Northland, and have been so excited to be here at Excelsior Springs as the CEO. So that's a little bit about me. I have two children that are married and 3 grandchildren. 3 of my 4 are educators and very engaged with the CAPS program as well. And 1 son is at Samuel U. Rogers working in finance. So a little bit of touch to healthcare and education all around in our family.
Perfect. Thank you, Kristen. Stacy, you want to introduce yourself and tell us a bit about your history?
Yeah. Hi, everyone. Good afternoon. My name's Stacy Benninghoff. I work at Platte County Health Department. I'm the Community Health Development Specialist. It's kind of a lot of words there. And I, as well as Kristen, started getting interested in healthcare when I was a kid. I loved the shows on TV of the hospital shows, the St. Elmo's Fire, like the ER and the Grey's Anatomy and all those shows. That's really what got me interested in, wow, I want to go walk around hospitals all day and do what they do. And so when I went to Missouri Western for college and I graduated with exercise science degree, I thought I was going to want to go into physical therapy. Tried that. No, didn't go into that. Ended up working at hospitals. So I was in those hospitals walking around just like I was imagining myself as a little girl. And I was doing cardiac rehab, lots of things in the heart unit is what I was working, EKG technician, things like that. And so I moved from right out of college, I moved to St. Louis, and so worked about 4 hospitals there, and then came back here to Kansas City 3 years later and started working at St. Luke's, now at their Center for Health Enhancement building, which is where people with cardiac events come in and do rehab after their heart attacks or bypass surgeries. So I did that for a few years and then came to the health department and started working for public health and working with the community. And I've been doing that for the last 15 years. And let's see, I've got 3 little girls. They're not so little anymore, but we live up in Platte City, and my husband's a teacher at Park Hill.
That's great. Thank you guys for the introduction. And I can see here we have a couple of teachers that have their kids watching. So hello to the classrooms that are out there. You guys are already asking some great questions. I don't know how old you guys are, but the fact that you're asking these types of questions, that's a really good sign. Okay. So we're going to move into the Q&A period, and Adam's going to run then for us the Q&A period. And I'll let him sort of take over.
So one of the questions that we have in the chat is, what part of your job makes you feel most accomplished?
So do you want to tee that up, or I'll go ahead if you want? I think feeling most accomplished is just getting to see the difference that you make every day. We see just a wide variety of patients, all ages that come in, and sometimes they're so sick, and sometimes they don't know what's wrong, and sometimes they're so scared. And not only the patient, but their family members too get so worried, because not only is their loved one in the hospital or not feeling well, but there's other things happening out in their life as well, like having to go to work or having to go to school and having to take care of kids. So I think when you can get somebody an answer and help them to feel better, or at least even just be a resource sometimes to say, I'm sorry this is going on in your life, but how are you feeling? And being able to be that emotional support to someone and knowing that you made a difference. And then there's those really good stories where somebody has been like maybe life flighted, and you're able to completely see them recovered or healed and come back to you and be able to say thank you. That just those are the wow moments. That's what it's all about.
Yes. I would say for my answer to that would be, we work with a lot of coalitions in the community, being in community health and development. And a lot of those coalitions, us working together and making things happen in the community. So we've changed like legislation before with some of our policies, and seeing that, being able to do that is just like a huge thing that you would never think you'd be able to do. Like those are the mayors and presidents and, CEOs, things like that. Those type of people that are able to make those big decisions. But it's very powerful to see when a community comes together, and the powers that be listen, laws can get changed.
And this question is for both of you. How do you stay up to date with healthcare advancements?
Lots of reading. That's what's part of the job that I love, is that it's not stagnant. It's forever changing. So you have to always be on top of current events, and lots of reading.
Yep. I think there's a lot of great resources out there that we get to work on too. Like as a physical therapist, there are associations that have information. And then probably what you've heard a lot of during this pandemic is we have the CDC, we have our Clay County and Platte County health departments that continue to provide us that information so that we can be consistent. And then there's hospital associations and health associations across all of the states. And I know in our state of Missouri, our Missouri Hospital Association is just an amazing resource. And they are available for the public as well as for us to be able to ask those questions in all different sectors of what we do. So I have to agree with Stacy, though, there is a lot of reading and trying to ferret out what's real and what's not real. And we always go back to what's a single source of truth to make sure that we're sharing the right information.
So the next question is for Kristen. As a CEO, what is the most stressful part of your job?
Oh, wow. Well, I think it goes back to one of the things Stacy said is, we have a lot of key stakeholders. I have employees, I have physicians, I have patients, but at the end of the day, I have a community that needs our hospital to be here. We've got a lot of people. One of the first things I saw when I came into my position is our livelihood. People in Excelsior Springs have a life expectancy 8 years less than people in Liberty. And that's very troubling. Why is that? We have to figure out how to make sure that we have a good lifestyle here. So I think life is really good in my life, and a lot of great resources, but making sure that we get those resources to our community members so that we continue to have a hospital here in Excelsior Springs.
So the next question is for Stacy. Can you explain in a few words how the pandemic has impacted your job?
That's a great
Well,
question.
that is a great question. Well, we have a special COVID team that came out of all of this. So we had to hire a whole bunch of new people that I've never even met. They work in a different building than I work at. I'm actually working from home right now and have been since March. And because my job, I can do everything I do from home, especially with all the Zoom meetings. It's very productive. They're definitely getting a lot more out of me productive wise. I do miss not being able to connect with my colleagues and talk to them after meetings and before meetings. That's when you can really do a lot of networking. But as far as changing for us in our department with the pandemic, I would say that we work with childcare centers, all the childcare centers in Platte County, and we meet with them weekly, and that came out of the pandemic. And so we've really created a bond and like support network. And that's one of the things that's changed. And really just a lot of Zoom calls. And I'm really not doing much with the COVID. I did get to learn how to contact trace, because we did do that in the beginning before we hired a COVID team, and worked the testing where you got to come to the health department and do drive-through testing. So there is a lot of new things that I've learned to do with the pandemic. And it's changed my job a little bit, but not too drastically, but that's just our department.
So I have two questions here for Kristen. The first one, it says, do you miss being hands-on as a CEO? And then the second one is, how many people do you supervise?
Okay, let me start first with how many do we supervise. Our hospital has about 275 employees, and I have about 14 direct reports that report to me. And I also report to a board of directors, which is about 12 people on our board. So there's quite a few people there. Do I miss the hands-on? I do, but what I try to do as a CEO, again, I think because I have that clinical background, I still am very engaged with our patients and still very engaged with their family members. So I'm happy to go out and being a part of a smaller hospital, I think you get this great opportunity to go out and engage with your patients. It's to pass meal trays or to be able to go in and round on your patients and be able to go in and just say, is there anything I can get for you today? Is there anything I can help with? And it's not, I believe my job is as important as anybody's in the hospital, and I am one of them. So if someone needs to get to the bathroom, I can get them to the bathroom. If they need a call light answered, I can certainly answer a call light. And I love doing that. And those are sometimes where you get those really great patient stories and great interactions. So I may not be doing hands-on right now, but still very, very actively engaged with all of our patients and the families. It's a great question.
And speaking of questions, these questions are coming nonstop. It's hard to keep up, but we'll do the best we can here. So the next question is for Stacy. The question is, why the transition to community health from cardiac rehab?
Oh, good question. My personality is I can't be doing the same thing all the time. Like I can do it for a while, and then I don't like cumbersome jobs. So this job was perfect for me because in public health, you have your hands in so many things all the time. It's very flexible. You are learning new things constantly. My week, I never know whenever the phone rings or an email pops up, I don't know where I'm going to be going. So you definitely have to be a great multitasker and self-motivated to be doing the job that I have. So to answer the question with cardiac rehab, I did cardiac rehab for about 5 years. which I loved, but it just started getting redundant for my personality. And I just needed something new. And as you can see, I've been with the health department for 15 years. So it definitely fits my personality better, because it's just, the day is never the same. One day is always different from the next.
So the next question is for both of you. What character traits do you feel are the most important to have if you want a career in the healthcare field?
I can go ahead first if you want me to, Kristen. Working well with others, like I said, being self-motivated, being a good communicator with any job, really. Have those good communication skills, to be flexible, to be able to wear many hats, multitasker. I think I said that. Self-motivator, excuse me, is very good trait to have, because sometimes you just have to come up with your own ideas, develop new ideas, create new ideas in my job. And you don't have someone telling you what to do. So you have to be the one to initiate and do all the things that your community needs.
I think I absolutely agree with everything Stacy said. And I think I would just probably add to that, being willing and open to suggestions and ideas and change, because every day is a new change, a new thought, a new process. But also I think, you know, in healthcare, I think sometimes we think it's so much about just being right there with the patient, but I always like to highlight there's so many jobs in healthcare that you don't have to be that extrovert. You don't have to be right there with the patient. We have lab jobs, we've got radiology, we've got dietary, we've got HIM. So you can just really, with anything you want to do, there is a tag into a healthcare position there somewhere. But I think really, I always believe, you know, the skills can be taught, but it's just having the attitude and the willingness to want to learn and to engage is really the most important thing.
I completely agree. So the next question covers, I would say, a couple questions, at least in the chat, but what is the most rewarding part of your job, and what is the most challenging part of your job?
Let me go.
Sure,
Okay. Most rewarding thing that I've done is something called our Back to School Fair program. I'm kind of in charge along with some other stakeholders, and what that is where families come, and it's a one-day event where they come and get ready for school. So they get all their backpacks, their school supplies. They get health checks, screenings with their vision, eyes, teeth, and they're ready for school. And they have to qualify. They have to be eligible to be able to come to this event. But it's very rewarding. You're bettering the community. You have a chance. These children have a chance to be ready for education in case they didn't have these resources to begin with. They start on the same foot as any other child that has those resources already and support. There's job opportunities there for the parents. They come through, and we have many community partners that are at the tables giving resources that are close into the community. So there's, sorry, I lost my train of thought. There's things for the parents to get as well out of the event. And it just impacts so many families more than I would even know. But the ones that do come through and do say something, you know that you're doing something good. And it's just better for the community and society and for our future, because we're making that difference, starting with those families and those little kids, and it goes on all the way through high school.
So I'll highlight on rewarding. Stacy highlighted, you know, within her agency being a part of a lot of different organizations. And we are as well. I'm so proud of our Northland because when you think about different hospital systems, a lot of times they tend to compete with one another. And that's kind of what you hear is which system's bigger than the other, taking care of more patients. But we really have something really unique in the Northland, and we all tend to work very closely together to make sure that our Northland families are protected and safe. And it's kind of like leaving no one behind. So our team here works very closely with the health agencies and with other hospitals. One of the things we did last summer before COVID, I always have that before COVID business. We were able to put together with a couple of our local dentists to have a local dentist day for people that didn't have insurance or didn't have access. And in that day, we saw over 53 patients that came in that needed services. And if you've ever had dental care, you know, it's not usually just going in, having a tooth pulled, and then you're done. There's always some follow-up. And our dentists were so impressed that and appreciative of our clientele that they needed to see, that they allowed a lot of folks to come back in and follow up with that. So I think what's rewarding to me is so many times in healthcare, it's like you feel like there's so many rules that you have to follow, which we do. But our team here is really much about you know, not asking the question why, but why not? Like, why can't we do that? Why can't we go outside the box and be able to treat more patients and see more people, and not only patients, but in the community as well. I think Stacy highlighted, you know, getting to sit down with the governor, sitting on a conference call with him every week, getting to sit down with the mayor routinely, knowing that we're a resource when anybody, you know, COVID is one of those things that's been really scary. And people sometimes don't pay attention to it until it happens to them or they get exposed. And I'm really, I'm pleased that people reach out on their cell phones, maybe on a Saturday or a Sunday, and say, oh my gosh, I'm scared. And we're a resource to them to be able to say, don't be scared. You've got hope and answers for you there. And I think that's very rewarding to be available to people. And Adam, there was a second part to that question, but I forgot what the second part was. Short-term memory span.
So we had the most rewarding and then the most challenging.
Most challenging. I think most challenging for me personally is I am a people person, and I want everybody to be happy to come to work every day, and I want everybody to love their job, and I want every day to be a perfect job. And sometimes in healthcare, it's not. It's tough. So that's where I come back and say, I like to hear everybody. I like to hear what their concerns are, but I also like for people to bring solutions, because it's very frustrating when we can't fix everybody's issues or concerns. And we all have a lot. We spend a lot of time at work, and I want people to have a really good work experience. So that's probably the frustrating thing, is not being able to meet 275 employees' personal needs all the time.
Yeah, I would say my most challenging thing is not knowing if we're making a difference. You think you are. I'm sure we are with prevention. It's really hard because, like Kristen said, no one wants to talk about it, no matter what it is, whatever topic it is: smoking, heart disease, diabetes, anything, until they have it or been affected by it. And you hope by educating the community on those topics that they're listening and they're making those health changes. But the challenging part is you just never know. You just hope you get, as they say, that saying is, you hope you just get one starfish. You help that one.
So before we go into some questions, maybe about, courses that you should take in college, there is one question in the chat from a Hilliard Technical Center nursing student. And the question is for Kristen. As the CEO of your facility and working more on the management side of things, how much of the day-to-day interactions do you get to physically be a part of and witness? And is your job more so just paperwork, or do you really get to see the difference being made?
That is a fantastic question, and thank you for asking and for being on today. It varies. Certain days are absolutely, and certain times of the year and certain times of the month, you may have a board report that's due, or you may have end of the month financials, or, back-to-back meetings and things like that. But other times we have employee meetings, we have employee recognition meetings that I like to be a part of, or we have care planning meetings that I like to still be a part of that. So I think what we have attempted to do for all of our administrative staff and our department heads is it is so very, very important to stay connected to your patients and your families and to your staff. And so we do active rounding. And I know we keep using that word rounding, but it's just making myself available, not saying come to my office, but go to the floor, go down to the departments and being able to say, how is your day today? Is there anything that I can help with? Is there anything you want me to know? And I think that goes a long way. And I don't know that it's rewarding for the staff, but it's very rewarding for me to get to be a part of their interactions, to hear their stories, and to be a part of that. So every day is a little bit of a different day. I'm a lot like Stacy, that if it were the same thing every day, I don't think I could do it. But we wake up every morning thinking we have a plan, and by the end of the day, sometimes that plan has gone completely off kilter. But at the end of the day, it's a good day, and we love coming back to it. So I hope that answered the question.
Yep, no, good answer. So this is a question for both of you. If someone was to enter the medical field, what are some courses that you should take in college?
That's a
Math.
hard one.
No. We were just teasing ahead of the call to say math, but I think it's very well-rounded. I know my course was very much math and science heavy, but in hindsight, I think, sociology, very, very important. Of course, your biologies, your chemistries, all of that sort of thing. But again, it kind of depends on which field that you are getting into. Our dietary staff, dietitians, it's a whole host of different classes that you can take. Probably. Stacy, what do you think?
Yeah, of course, tons of science. And with in the health department, we have nurses, we have nutrition specialists, we have environmental specialists, and so we have the whole gamut of classes that you would have to take in those fields. That, like Kristen said, very science heavy, a lot of biology, anatomy, those type of courses, medical communication courses, things like that. But once you get into those you're going to know if you like the field once you get into those, and you're doing what you finally get to do after you get done with those general ed studies. So you'll know if you're in the right spot.
I think there's also a lot in healthcare now that ties into finance. I like to tell one of my personal favorite stories is my son always thought he never wanted to be in healthcare. And now he is a healthcare administrator down at Samuel U. Rogers, working in the finance field. And his whole entire background was all finance. So never has had a healthcare course in his life, but is loving what he gets to do down there, helping with people and their bills and finding opportunities for them to be able to have access to care, and managing the process for getting people Medicaid applications, or how they can have services and how they can pay for it. So he's loving every minute of that, and didn't have a healthcare course, so a little bit of an anomaly.
And speaking of the healthcare field, actually this kind of ties into our next question, but for both of you, what other jobs in the healthcare field did you consider?
Oh gosh. Well, I think I kind of went through that a little bit in my intro. My first was that I was going to be a pediatrician, and then it went into athletic training, and then it was physical therapy, and for a while I was going to be a dietitian, and then I was going to be I went back to athletic training, and then back into the world of physical therapy, and then my master's in health administration. So the point that I still want to do out there somewhere is getting into human resources, because I think that's just a really fun area to explore.
I apologize. I didn't hear the question because someone came in here. What was the question, or was it even the question for me?
Oh yeah.
Sorry, I'm trying to pull the question up, and
It's all right. Sorry, I apologize. Someone came in here and I couldn't hear a thing what you guys were saying.
What areas of healthcare were you interested in going to, maybe besides this one?
Oh, okay. Physical therapy is what I was interested in. What I thought of first is what I was going to go for. And then when that didn't pan out, and when I took some internships with some physical therapy offices, I was like, nah, I don't think I can do that to people and make them make them work that hard and hurt. And so then I was like, oh, great. What am I going to do? And then the heart, anything with the heart was very interesting to me. And so I dabbled in I did EKG technician. I did some stress testing things, and then fell onto cardiac rehab, like I said earlier, and worked in that field for some time.
So the next question we have, and this is especially a relevant question for students in middle school and high school, but how did you know what path in the medical field to take? And do you have any advice for those who may be unsure?
I can speak for myself. My path changed completely from what I thought that I was going to be doing as with my degree as a physical therapist to all the different things that I've done in business and business administration into healthcare administration, that sort of thing. I think be open. And I think especially the younger you are, what ignites and starts a passion or what sparks your interest, chase that, follow that. I think sometimes, we were talking like, oh, when you're in high school, I think when I was in high school, I'm way old, you guys, but like as a junior, you had to figure out what you were going to do in your life. And I was freaked out by that. And now we're talking like fourth graders need to have an idea of where they want to go, because that's where you start kind of working towards your degree and your thoughts. But again, I think it's nice to have a thought, but what excites you and what sparks you, but then also don't be afraid to change if something comes up. And we had a CAP student, my first CAP student here came in under graphic design and had a wonderful relationship. And 2 days into her going into the radiology department, she totally fell in love with radiology and ended up going into a radiology program. So, keep your eyes open and your ears, but definitely do something you want to do. Don't do something just because someone tells you you should.
Yeah, I agree. Or for the money. We were talking about that earlier on the call. When you strike gold when you go to work every day and it doesn't feel like a job. I know you've probably heard that before, but just like Kristen said, don't be afraid to change your path. You might like something way more than you thought you would, and you think you're going to be, some kids they know what they wanted. Students know what they want to do, and they have a path. And don't feel bad that you don't have that path. It will come to you, and you will get all the experience, get all the internships that you can, and to see if you like that path that you're going to take. I did that, and that was very helpful for me to get jobs in high school, in college, in the areas that you think maybe you want to work in, and test the waters.
So we have about 2 minutes left. So this will be the last question, and it's for both of you. If you could summarize, what is a typical workday like for you?
Well, yeah, go ahead.
Oh, it's okay. Go ahead, Stacy.
Like I think we were both saying before, no day is the same. I mean, man, so just today, I'll give you my typical today. I started off with a board meeting. I'm on a board at the YMCA up in Platte City, and we had a board meeting. I came home because I'm working from home, and started checking emails. We had our guidelines come out last night from our board for the new guidelines for COVID for Platte County. And so I'm scrambling, trying to let everybody know that's my contacts and colleagues. And then right now I'm sitting in our new building, letting daycares come through and pick out anything they want, because it was an old daycare building. And so, like I said, we are childcare health consultants for daycare centers. That's another hat that I wear. So it is just all over the place. That's what I did today. I don't know what I'm going to be doing tomorrow, but that's what makes it fun.
We're in that same boat. I know COVID has kind of changed up some things to our, a lot of my job, I think is really exciting and fun. And it's the socialization part. It's not only being inside the walls of the hospital, but to be out in the community and be a part of that community service. And we're kind of missing that right now, that social interaction of being able to go out. So normal day typically starts around here about 7, and we usually start with a stand-up meeting with our department heads, just kind of get a feel for what's going on in the hospital that day. Then we'll do a senior team quick stand-up for about 10 minutes, making sure that we are all on the same page, and had what's called a hospital incident command meeting today, which is talking specifically about COVID and the plan. And as Stacy said, Clay County came up with new guidelines last night that we wanted to make sure everybody was on the page, and how are we keeping our community safe. A Chamber of Commerce luncheon where you get to go and sit with the mayor and the city manager and different folks there and kind of presenting what's going on, and getting to interact with you all because we miss our kids, and helping just be that community resource. So some days are meetings and some days are budgeting and finance and all that stuff. But every day's a new day, every day's a new, and hopefully at the end of the day, you get to go to work the next day and be better than the way you were the day before. So it's great.
Well, my goodness, I can't believe we're actually a minute overdue already with our stop. This went so quickly, and I can't believe how many questions we had here. Most of the sessions, we've had probably 20 total questions, and we got through 20 or 25 with 20 extra ones that we didn't get to. So you guys had asked questions that didn't get them answered. I want you to know they were really good questions, and those are things you should explore. I think the interesting part of the theme of today, and especially the message you guys gave us today, is like, this is about career exploration for the kids. So your only way you're going to figure this out, the questions that you were asking, is you go try things. If you're growing up in Clay or Platte County today and you're not going and checking out NCC or Northland CAPS or trying to job shadow or listening to guest speakers and coming to events like this, like, you're missing the boat. We want you to go explore those things, but it's okay to change your mind. And that's a big part of today too. There was only one speaker we had this entire day that knew when they were in high school what they were going to do and ended up in that job. Everybody else has went through various routes to get to the end path. So again, thank you so much, Kristen, Stacy, for taking time out of your day and sharing your passion and your insight with us about just the amazing careers. And you kids at home understand that we met 2 professionals in this session out of like 1,000 amazing career opportunities in healthcare up here in the Northland. So all sorts of opportunities for you. And I hope you take the time to go learn about those and figure out where you belong. When I click the in button here in just a second, you're going to get a survey that pops up on the screen. We urge you to take that. It's going to take you like 1 minute to fill it out. It just helps us get better at this kind of event in the future. And this video, we're going to try to find a way to get it on YouTube or our website later, so you can come back and watch it later. And if you want to learn more about NEBA and what NEBA does and how we can provide opportunities for you, especially teachers in the room, go to nebaworkskc.org, and you'll find a lot of information there. So on behalf of me and Adam and Julie here, thank you so much for making this just a great session, a great day.
You
Stacy,
guys.
Kristen, thanks for your time.
Thank
Have
you.
a wonderful rest of your
A lot
day.
of fun.